Okay, we good? No, we're hold. Hello, everyone. Welcome to Concordia University's Fourth Space, and thank you for joining us for today's special event. Now, to help situate you, we are streaming to YouTube live from Fourth Space, and we are located on unceded Indigenous lands in Chichage, Montreal. Here at Fourth Space, we work with our university community to help mobilize knowledge by co-creating daily activities that examine research questions, projects, questions, things in development across the university. We're running today's event as a live stream Zoom meeting, so we welcome comments and questions via the chat. Those of you in the space, if you'd like to participate, just let us know and raise your hand and we'll bring a microphone over to you. With that, it's my pleasure to introduce Cecilia in a CHSLD, which is a scene created by RECA, the Ressources Ethnoculturelles contre l'abus envers les aînés. Welcome.
This is lunchtime in Cecilia's CHSLD, and you will meet the people who are helpers and family of Cecilia, and you will hear what each of them is thinking before they meet each other. I realize I didn't speak into the microphone. So I would just like to say that you are going to meet the persons involved in Cecilia's care in the CHSLD. So I'd first like to introduce you to Cecilia and Cecilia's inner thinking.
I want to be in my own home. They don't speak my language. I don't think they like me. Will I die in here?
Mariana, her sister.
There's always something to deal with when I come to visit my sister. Last time I visited, she smelled. I asked that she receive help, but they said I would have to wait for a shift change. I left before this arrived. I will see the administrator again about the care that she is not receiving.
The préposé.
She is certainly not one of the easy ones. I cannot speak her language, and so she never speaks to me. It's lunchtime, and I'm already behind schedule for others in need of help. Cecilia, don't give me trouble today. I am too tired and not in the mood for you.
The administrator.
I am doing my best, but I will admit I am not a miracle worker. I don't have enough staff, and they are not always trained enough for the challenges taking care of such a diverse residence. Yes, I know there is some mistreatment, but as long as I haven't received a formal complaint, I do not need to act.
Actors, take your positions, and when you're ready, begin. Do not forget us. Do not forget us. No to broken promises.
No to broken promises.
No to insufficient funding.
No to insufficient funding.
No to short-term solutions.
No to short-term solutions.
Yes to substantial support for home care.
Yes to substantial support for home care.
Yes to a philosophy of caring in long-term care for elders.
Yes to a philosophy of caring in long-term care for elders.
Yes to respecting language and cultural diversity.
Yes to respecting language and cultural diversity.
I think no matter what, Reka would want for our elders and for ourselves respect. And we have done this in honor of those who have died during the pandemic, the elders and the caregivers. And we say, we must take action now for the living. Thank you. I guess we rearrange the room, yeah? Transition.
Can you hear me now? So hello, everyone. I'm Sarita Israel. I'm the moderator for this very special panel we have this afternoon. I am a coordinator of a domain of expertise that counters mistreatments of older adults. And today we're going to talk about a topic that is really important and that really needs to be addressed, and that is mistreatment in long-term care. We have today three very, very special panelists. They all are renowned in their respective fields. They all have done work that is recognized in this area to counter mistreatment to older adults. So I'd like to introduce our three panelists. I will start with Mélanie Couture. Mélanie Couture, she is a chairholder of a research chair on older adult mistreatment and an associate professor at the School of Social Work at Université de Sherbrooke. Her research in social gerontology spans over a decade, focusing on co-construction and integrating clinical and organizational innovations to prevent and manage mistreatment in caregiving, calming living environments, and technology use for aging in place. Mélanie holds a doctorate of clinical sciences from the University of Sherbrooke. Welcome, Mélanie. Helene Derfel. Welcome, Helene. Helene Derfel is a Montreal Gazette's medical reporter specializing in investigative and narrative journalism in a more than 35-year career that has taken him across North America. He is a three-time finalist of the National Newspaper Awards, and in 2024, he won the Canadian Hillman Prize for Investigative Journalism for an expose on the likely preventable deaths of 6 patients in an overcrowded emergency room of Lakeshore General Hospital. Helene's 2020 investigation into the horrific living conditions at the Résidence Errant nursing home earned the grand prize of the Prix Judy Jasmin, Quebec's highest journalism accolade. The same reporting was nominated for a Michener Award for meritorious public service journalism, considered Canada's own Pulitzer Prize. Quebec coroner Guillaume Camel publicly thanked Mr. Derfel during his inquest into the deaths of the Huron, suggesting that his reporting probably saved lives. Welcome, Aaron. Our third panelist, Helene Klodawsky. Independent filmmaker, Helene Klodawsky is a Montreal-based storyteller committed to portraying political and social struggles, as well as to exposing the documentary art form. Through her work, Helene has exposed political and social conflicts, as well as a documentary art form over 4 decades. Her films, screened and discussed around the world, have won awards and nominations from Academy of Canadian Cinema, Hot Docs, Les Rendez-vous du Cinéma Québécois, Rencontre d'Arts National Documentaire de Montréal, Jerusalem Film Festival, and the World Press Photo and Festival, to name but a few. Broadcasters include CBC, POV, PBS, Channel 4, Canal Plus, and the Australian Broadcasting Corporation. Welcome, Helene. So this is just but a brief biography, and I'm going to ask each of you if you can briefly describe to the audience the work you've been doing to counter mistreatment in long-term care. So I will start maybe with Mélanie.
Is it working now? Yeah. Okay. So for people who don't know, research chair, the main idea behind that is actually to take research and synthesize it and make it usable in real life. Okay. And we also do a lot of knowledge transfer. So that's why I'm here today too. So we can talk to people, hear what they have to say, give some information at the same time. So my research chair is from the Ministry of Health and Social Services in Quebec. But this also means I can tell them when I don't like what they're doing. And actually, I'm in multiple committees also to help make decisions that are actually based in science, that are evidence-based. Because sometimes we think it's a good idea, but when we look at what has been done elsewhere, you can see that maybe it won't work, or worse, it's gonna make it worse, okay? So my job is to help use research to counter mistreatment, but also try to better support older adults at the same time. So it's not just about saying what's wrong, but it's also saying what should we do instead. So that's my job.
Thank you. Aaron?
Hi. So I was going to give a little presentation. Do I do that now or?
Oh, yes.
Yeah, so let's just put your slides up 1 second.
Okay. I'm just like, okay, I'm just, all right. If we can go back, that's the last one. We can go back to the first one.
I'm not sure of the order, so you can just tell me which slide.
Okay, it would be, another newspaper article that shows the, yes, this is it.
There you go.
So it was a little over 4 years ago that I wrote this. If you can go back, please, to the previous slide. Is there a way to go back to the previous slide?
There is, hold on.
Okay, all right. Okay, that's it.
There we go.
So this was a shocking story for Quebec and for the rest of Canada because these residents were abandoned in the middle of a COVID-19 outbreak. The Quebec College of Physicians investigated this and determined that the residents were not abandoned, but then the coroner, Jehan Kamel, held an inquest, public inquiry, and it was determined that they were abandoned. So you would think, and some of these residents were found dehydrated, our elders dehydrated. There were some who had died not because of COVID, and then there were those who died because of COVID, as if the fact that they didn't die because of COVID, that was less of a tragedy. And so the premier, François Legault, he, in the wake of this, he announced that he would hire préposés aux bénéficiaires. He would train, I think it was up to 10,000 of them. Some of them demandeurs d'asile, nos anges gardiens. But what's happened is that a third of them quit before their training. And then I think it was last year, Christian Dubé, the Ministre de la Santé, he said that the Quebec was short 11,000 préposés aux bénéficiaires. So has there really been progress? This part of my presentation, has there really been progress? I'm sad to say I don't really think so. If you can show another slide that shows the situation in home care. And this is it's a simple chart. It's a simple line chart. It's if you can please put that up.
Yep, we're just facing a few technical glitches here. We'll get to you in just one sec. So
it is true that the Legault government has invested a lot more in home care, but the wait list for home care has exploded, and so that's it. So when you look here, you'll see that it's almost doubled. It's almost 19,000 people who are waiting for soutien à domicile. And before 2020, it was around 10,000, so it's doubled. And the demographics in Quebec right now, 1 in 4 people are, 1 in 5 people are or at least 65, and in a few years it'll become 1 in 4. So the need for home care is greater than ever, and people want to live at home. They want to be mobile. They want to be productive. And so, if they don't receive the home care, sometimes they take a bad fall and their conditions deteriorate. They end up in long-term care. But if you can now show the next slide, which is the bar charts, the wait list to get into long-term care in 2020 was 2,400, and it's now almost 4,000 people waiting to get into a public CHSLD. So, you know, they're trying to, because they can't get into a public CHSLD, they try to get into a privately run one, but there are wait lists to get into privately run ones. So these families are agonizing, and our nos bâtisseurs are just living in horrible conditions. Something I was talking about with Helene is that this mistreatment, this systemic neglect, you know, there might be bad actors out there, but I think that there's overall systemic neglect. It's expanding beyond long-term care, the CHSLD, and I'm writing about how it's occurring in our emergency rooms in acute care, with many elders spending days at a time in the ER, in corridors, not on a stretcher, developing bed sores. And if you can call up the last slide, this is a very worrisome practice. It's a newspaper article. It's the last newspaper article. It shows a picture of a patient restrained. It's not that one. That was the first one you showed already. It's this one here. If you could just, yes. So that's it. So Quebec is, across Quebec, this is a problem across the country, but this is happening again in Quebec. The various institutions, whether it's a CHSLD or it could be a psychiatric wing in a hospital or in an ER, they're placing patients in restraints, not as a last resort under very specific circumstances. You have to follow a protocol, but they're doing it because they don't have enough staff, and they're restraining these elders against their will. They become prisoners. And this is happening now. This mistreatment, this systemic neglect is now moving from, well, in addition to long-term care, into acute care in ERs across Quebec. It's truly deplorable. So I just, as a journalist, I want to flag these issues, sound the alarm, highlight them, you know, keep the focus on these issues so that the government takes action, because otherwise they would like to sweep it under the carpet.
Thank you. Lena?
Hi, my name is Helene Klodawsky, and as Sarit says, I'm a filmmaker, and I just want to say thank you for the theater piece from Reka, because I too believe in the power of storytelling, and even though the dialogue was very sparse, we really felt the vulnerability of the situation and how people are so stuck and restrained in what they can do or what they feel they can do. So thank you for that. And as a storyteller, I've been working in documentary film for about 40 years. And honestly, I never expected to make a film about negligence in long-term care. I didn't want to really, because, you know, let's face it, the subject is scary. We don't want to think that we're going to need long-term care, institutional long-term care. We don't want to think that our loved ones will. But what changed for me is, of course, COVID, and I had friends whose parents and loved ones were in long-term care, and they immediately understood how unprotected people were, because they understood already how fragile the system is. But then what else happened to me is that just by accident, I came across a YouTube of a press conference with a young lawyer, an elder rights lawyer who fights on behalf of families against negligence in long-term care. So she actually takes, she tries to take corporations in the private healthcare arena, and she tries to take them to court for systemic negligence. And when I saw her and I saw how she spoke so passionately, I just knew that she was going to be a character in my next film, and I called her up. I didn't have money yet, but I just said, I think we need to make a film together. And that's what happened over 4 years. And over those 4 years, I was so surprised because, as I say, I didn't know that much. But I was so surprised at what she encounters every single day with families contacting her, families who trusted the system, who didn't know that long-term care would be different than, let's say, being in a hospital, who need that help, who want to protect their elders, but are bringing stories of dehydration, starvation, falls, pressure sores, with photographs of wounds and stories of people sitting in diapers. I mean, it's just unacceptable. So there, over 4 years following Melissa tried to make a case against systemic negligence, what Erin is speaking about. I learned a lot, and I learned that long-term care, it's not a subject that we should be turning away from. It's a very dramatic environment where we encounter ableism, we encounter ageism, we encounter racism, we encounter ideas about healthcare and the profit motive. But what really, really surprised me, again, a number of surprises, is that it's also a site, and not only in Quebec and in Canada, but of extractive capitalism. Like, people are making a lot of money from the elder care industry, and this is where my film really looks at. I don't know if you have the ability to show the little trailer of my film. It's 3 minutes long.
We're just setting that up now.
She had a stroke, broke a bone in her neck, and she'd been lying in bed for 6 days with nothing but Tylenol.
How hard would you fight to make sure that your loved one is properly cared for?
We want justice! We want justice!
You had a loved one that suffered in long-term care. I kept hearing the same things over and over again. This is not a coincidence. It's something I really want to dig deep and discover.
Systemic failure across all the companies while they bring in record profits.
$1.1 billion in revenue, and they are locking up incontinence pads. It puts all of the blame on the staff when they're a victim as much as the resident.
There is no law to report a medical facility for improper care.
And only one person to look after 40 people. Hurry up!
The residents needed more than what we were able to do.
It's only going to take one smoking gun to blow this open.
Yeah. The damages are very low. Why? Well, old people aren't worth that much. There's this ageist attitude.
There's a complete and utter lack of transparency and accountability.
The cases are unfolding.
They are going to make your life difficult.
I don't even have a sense of how successful I'm going to be.
I will do whatever it takes to change these rules in nursing homes.
My client's relying on me for that last piece of accountability and justice. This is going to be one hell of a fight.
Thank you. You know, it's interesting. I think in the course of your work, you have mentioned that you had a few surprises. You start looking into something, and all of a sudden you realize there's a lot more to know than you thought initially. And unfortunately, some very bad things. I don't know, Mélanie, have you had any really big surprises during your work?
I'm going to steal yours. Well, actually, one thing we have to understand is that in Canada, Quebec, we're not the only place. It's worldwide because People say that there's too many older adults, but that's not true. Actually, is that people stop making children. So we're already blaming older adults for being there, while I mean, it's the lack of children that's actually making more older adults in a way, proportionally. So that's important to understand. So from the get-go, there is an ageist stance that brings bad things forward. And the thing that we also have to understand is that it's not only about the older adults, it's also about the employees. Because they are stuck, they see it, and they feel helpless. And that is also important. So it's the families, it's the employees, and the older adults also that are suffering in these types of situations. The thing is, we won't have much more labor, okay? The labor force is getting smaller and smaller. So we do have to find new ways of doing things and making sure people are okay and feeling better. And that's why in my resume at the beginning, you heard about technologies. So I'm looking at, we've been implementing technologies in different contexts to actually help to identify the needs of different peoples, of older adults, to be able to actually fulfill those needs. Because one of the things in long-term care is that usually older adults cannot express their needs. So people have to guess, and if they don't have time, they don't see it. So the idea here is to actually, the first thing is to identify needs, to be able to fulfill them, see them, not ignore them. And also it's about giving people tools and what they need, because like you heard there is that sometimes they can't even have the diapers that they do want to change diapers, they're not allowed to take more and things like that. And what I think is sad is that it's like for everyone, for older adults, it's always the bare minimum or even lower. It's like they're not allowed to have cookies because it costs money, and it's not it's not a basic need. You know what I mean? So if we're getting there, which means it's like you're not allowed to be happy, you're just allowed to be there. And I think that's the real problem. We're forgetting that it's people. And we do have to work with that. But like I said, it's worldwide, so it's not, we're not the only one, and we do have to innovate, because we can't do things like we used to because we don't have the staff for it. So that's why we do research, we try to go further, but and some things are working, so that's important to know. But if we're dreaming about more staff, it won't happen. So we have to find other ways. So if we keep thinking about, we need more staff, we're not doing anything, and nothing will be solved either. So it's about fulfilling more than basic need also. And I think that's what's important.
Oh, I have what was the question? I agree with you, everything you said.
Well, basically, I think that in your work, you've encountered, some situations that may have surprised you. You thought you understood the problem a certain way, and then you had surprises about, maybe the magnitude of the problem or some actual, details, a little bit like what you're seeing in terms of all of a sudden things being repeated, not only in long-term care, but in acute care settings.
Yeah, that's something that surprised me, is that this is, this mistreatment is, and I want to emphasize that when we're talking about staff, I don't think that there's anyone out there who is purposely trying to mistreat. They're suffering what's known as moral injury, that they must countenance egregious situations they don't want to have any part of, but they're in this system. That's why doctors and nurses are contacting me. They don't like what's going on. They become whistleblowers. So that's what surprised me, as well as I said, when I was writing about the heroin and they were comparing it to a concentration camp, one of my sources. But I'd like, my journalism to be solutions driven as well, not just to purely sound the alarm. So I do think that, at a certain point in someone's life, say following a stroke, they need, and dementia, they need that round-the-clock care. No one can stay at home forever, okay? But I do think that that Quebec is so focused on this hospital-centric approach, And I think we do need more preventive care, preventive medicine, and that is going to require a cultural change, more visits by home visits by doctors and nurses to keep people at home for as long as possible. I think that would help. Every little bit of modest progress is nonetheless progress, and we should work on those sorts of things. And I do think, perhaps there could be more legislation, more regulations to punish the bad actors out there. That's what I would say.
Thank you. I agree with Mélanie that this is not just a situation in Quebec or Canada, it's worldwide. And I think what I was surprised to learn is just how much money is involved. I mean, governments giving money over to corporations to help solve the problem. Where is the money going? Is there accountability? Is there transparency? No. We need to demand more of that. And in terms of the private-public partnerships, is all the money for care really going into care? Because it's true, the jobs are so poorly paid. People have no time to even do their work well. So there's so much demoralization and exhaustion, and it's often a workforce that is migrant or vulnerable as well. But in terms of fighting back to fight for more transparency, there are people like Melissa and people all over the world who are demanding, let's look at what's going on. Because I was very surprised, for example, to find out that our pension scheme, this is Canada-wide pension scheme, is invested in for-profit long-term care, not only in Canada, but in Europe. So on the one hand, we're increasing our pensions by being in exploitative long-term care investments, because it's just crazy. Because one day, even if we have better pensions, we might end up in long-term care, needing that good care. So there's something very, very dysfunctional, and we need to call this out.
Actually, absolutely. And I think that one of the issues is we've talked about, and you've talked about, cases that have been either filmed by someone or that people have spoken out about. But today we saw that play. There's so much that is not spoken about. I mean, people know that mistreatment is taboo, so they go through great lengths to hide it. So unless there's a witness to it, or unless someone tells you about it, I think a lot of mistreatment goes unnoticed and it's invisible. And we're just wondering, I mean, what can be done to make it, put it out there and make those situations. Put those situations so something is done about them. Mélanie?
Well, as I said earlier, as part of the research chair is about knowledge transfer. And we still know that even if there are laws in Quebec, there are training available, there's a lot of things available, people still have problems identifying mistreatment situations. So if somebody hits someone, no problem, people know this is it. When we talk about psychological mistreatment, financial mistreatment even, unless it's big amounts, it's unseen. So the idea is talking about it. And I see a difference now. We at the research chair, like I said, we are developing tools. For right now, we're actually developing a tool to identify mistreatment in long-term care. So to find ways to make it more obvious and heard. And also, what we're doing also is a lot of training and tools to help people understand what is mistreatment. So we do have a website, is maltraitancedesainés.com, and we have it in French and in English. Some of the tools are only in French, but we try real hard. We actually have someone who can translate everything within our team, so we can actually get things out in English also. And we just started a podcast. So right now it's in French. We have a few in English, but we haven't launched the English one yet. So these are coming. And this is to inform people, but to make them think about their lives also and the lives of their loved ones, of their the clientele, to see those little specks of mistreatment that usually become bigger and bigger and bigger. Because mistreatment in a way is a lack of respect. So if nothing is done, then you disrespect even more, and then you go on, and it gets worse. Because, like I said, people sometimes don't report because they don't think it's mistreatment. And this happens a lot. But the other thing also is that sometimes they don't know where to report. Even some of the clinicians still don't know where. And the first thing I would have to say is that in Quebec, if you want to talk about a situation, is to call the line. And they are there to talk about the situation. They can help people to actually say, oh, is it mistreatment or not, when you're not sure, and then they can refer somewhere else also. And that's important because it's not in every country that we actually have a dedicated line to talk about this situation. So this is super important. It's often the first step before people will actually report and do something about it. So, and we are slowly trying to structure the response to older adult mistreatment to make sure that no cases is just left there and nobody's doing anything about it. So we're slowly building. Like I said, we're actually pretty far ahead of many countries in this respect. But people have to talk. That's the thing. If people don't talk or don't recognize it, we can't do much about it. So that's why your work is important, because it actually helps people say, okay, so that's mistreatment, so I can actually do something about it or report it. I don't have to live with it. And the more people report and it goes in the media, then, like you said, they have to do something about it at one point because it's too big. And I would just like to add quickly that I actually did a study recently and about mistreatment in private residences, and it's bad that it's happening, but a good thing is that we actually launched the different tools. We got media coverage like never before. So I did like maybe 20-something interviews in the media in French and English and everything. So people are starting to talk about it even more in the media, so it's out there, and I'm pretty sure this is going to help with this cause, and so people won't stay with the situation and not talk about it, and nothing will happen. So that's super important, and the more we know about it, more people can report also, because it's not just about the families and the victims, it's actually about everyone too.
Your answer was so thorough. I don't know what I can add. I will say that Rekha, your play was quite eye-opening because it focused on probably these scenarios are reproduced hundreds of times. This passive-aggressive. Does it cross the level? It's not. When we're talking about pressure sores and being dehydrated and not being your incontinence products not being changed, but this is a mistreatment nonetheless. That was so good that you highlighted it, and I think that just this panel discussion is a great step in the right direction. At Université de Sherbrooke, what you're doing is absolutely phenomenal. That has to be done. You're giving us the tools. Your documentary was eye-opening. We're doing our part. What I'm finding out now is, since I wrote, there's this momentum that's building. Since I wrote my series on the Lakeshore, I'm finding that more journalists are reporting on what's going on in emergency rooms. And a lot of the instances are. I think all of the people that I wrote about, these were 6 preventable deaths. They all occurred in elders, and so there is this groundswell of awareness. I think that's the first thing is that awareness, becoming aware of it. So we're all doing our part here, and we have to keep that momentum going. I'll leave it up to the experts in terms of like the various things, but my role is sort of like very circumscribed in reporting on things that are unacceptable. And as I said, I'm really upset about the growing use of restraints. I'll pass it on to you.
Oh, I have one here. Yeah, when I hear about Melanie's initiatives, and I'm familiar and very inspired by Erin's work, I also think that we need to differentiate between the care worker in the institutions who are frustrated and who feel very constrained in what they can do, who feel overwhelmed and just can't stand the conditions of work. So we have to see that, but we also have to see what is coming down the line from the institutions, whether they're private or public. And in the end, we need people to follow the money. And it's very, very tough to do. There's people that are doing this kind of research to see where, who are asking, where is the money that we think is going into care? Where does it really end up? So I'm interested in that. And I think, I think all the action and the resistance to what's going on today, I think it has to happen on different levels. The very micro level of having your loved ones record what's going on, but also asking our politicians, how are we funding our long-term care?
Actually, you bring up a very important point, and it's the multi-level aspect of it. And Mélanie, and you all talked about reporting. You were actually, whistleblowers from inside called you to speak to you. Now, that's actually not that common because people don't always report. They're seeing it. There's a lot more people that worked in that institution than the few people that may have contacted you. But reporting is not easy. What stops people from reporting these situations?
Well, from studies, what we see is that, first of all, people are ashamed. They kind of feel that it's their fault, or they're not doing their job, or they don't want to be the one that's being blamed for the mistreatment either. There's the part of the helplessness. It's like, wow, why should I report? Nothing's gonna happen. And that's a problem, because if nobody reports, nothing's gonna happen. So that's why that's important. There's shame. They're afraid that something bad's gonna happen to maybe the orderly that they like, and they usually don't feel that it's the like you said, the organization that's gonna be put in a bad situation, but more the employees. So they don't want to, something bad happening to the employees. And what you have to understand about this type of mistreatment, there is a few people who are actually acting on their own and intentionally doing mistreatment, okay? That's the minority, but there are still people like that. But what we're talking more about today is really organizational mistreatment. Organizational mistreatment is actually embedded in the different practice, what people do or are told to do. So you actually have to go up and analyze what's going on. Why is that in place? And the other thing about mistreatment, if you look at the definition, it's actually about the consequences, the harm, thank you, the harm that is happening. So you have to document the harm. This is doing this type of harm. So how can we do it differently? But you also have to understand that even if we change things, like I said, sometimes the result is not what we wanted in the first place. So it's really a trial and error process also. But the thing is, in Quebec, we're pretty much standardized in a way, not totally, but in a way. So if we do find that one practice is not a good thing, then you usually have to change it everywhere at the same time. So that's the advantage of a public system, though. But still, you have to identify which practice, what's doing, and then you can start to change things. But the excuse always, we don't have enough money. Yeah. We don't have enough staffs. But in one instance, they're doing some pilots projects, and one of the pilot project was actually to let pitchers of waters out to help people drink when they need to. Because the idea was, no, we can't put them out because some people can drink water when they want. But I mean, that's a minority also. And what they found out is that people were less fidgety because they were actually having enough water, and a lot of things got kind of resolved by just adding more water available. Okay, so sometimes it's little stupid things that make a big, big difference. But the problem is that when the pilot study finished, they stopped putting out the water, even if the results were really good. So for me, that's where the problem is. If you do find something that works, that is not that demanding, put your energy there. Instead of saying, well, we don't have it. No. This is gonna help you solve a lot of bigger problems that's gonna be coming your way. So that's the part where I'm still angry. So I mean, we found something that worked, just apply it. But implementing things is really hard and changing. But even when you have proof that it's actually wonderful, it's still hard to change the way people are doing things. So, but that's my idea. Find little easy things to do to have a really big impact, but you do have to evaluate to prove that there is an impact. And evaluate to make sure there are not bad impacts. Because this also happens when we think we want to do good, we don't always do good either. So that's super important. Yeah.
You talking about the whistleblowers? Was that like, yeah. So on that issue, there is this culture of omerta, that you cannot speak out for fear of losing your job or being disciplined. This does exist. Quebec set up a tip line called On vous écoute, but I guess it's useful to some extent, but the people are still worried about it. And you know, in my series, the whistleblowers they contacted the office of of Christian Dubé, the health minister, and they didn't follow up. And then, following my series, there were some nurses who were there was one nurse who had his license suspended for 5 months. So you know, you have people who are scared to speak out. But despite all this, despite all those challenges, you have a few brave individuals who, like for the series that I just did, I had this. You know, one nurse contacted me, and it was a doctor who contacted me, and I said, I need more sources. So I ended up getting 4 other sources, and that helped, you know. But you know, these are healthcare staff. Some of them start to drink heavily. You know, I had like a nurse calling me up a few times and late at night, drunk. You know, self-medicating in that way. They're under tremendous stress, and as I said, they're sustaining a trauma, a psychological trauma, a form of moral injury, because they're being put into situations they don't want to be put into. They don't like that, and so they sometimes speak out to certain journalists. And what I try to do is honor it by getting documents, and you know, being able to prove it. It's a hard thing to prove it, and to be able to show that, you know, the government's response always. It's an isolated incident. Okay, this is the standard response by the government. It's an isolated incident. So I know that. I know that they're going to say it's an isolated incident. So that's why I tried to show it's not an isolated incident, right? It's a pattern. So I'm taking into account that they're going to say that. So and then, of course, so you know what they do is they say, okay, we're going to launch an investigation. So they feel that they've launched. So first, it's to say it's an isolated incident. If they can no longer say that, then they'll say, okay, we're launching an investigation. And then people say, oh, wow, it's an investigation. It's very impressive. So what I have to do is follow the investigation to show whether they're doing something or not. And so, you know, that just shed some light onto what I do as a journalist.
I can just say that when I was doing my film, for example, I found it really, really, really hard to get care workers to speak out because they were so frightened. And many had signed non-disclosure statements when they got their jobs. And many are very vulnerable workers to begin with. They don't feel that they have a lot of stability in terms of their positions in Quebec or Canada. And it was, I found it, I was really surprised. This is another surprise because I've done films in areas of war, you know, during wars and ethnic conflict, and it's always a challenge to get people to speak out. But care workers in Canada are more afraid of someone in a war situation to speak out. I'll just give one example. Melissa did a kind of public action in Ottawa, and we wanted to read excerpts of care workers' statements, what they were experiencing during COVID. And people were so frightened that they didn't even want to be quoted because they were afraid that they could be identified. So this is, I'm so glad that people are contacting you, Erin, to speak out, but it really takes a lot of time and a lot of bravery and reassurance and finding people that are not in the system anymore to speak out about their situations.
Actually, you know, what you're saying is really important and speaks to, it's not only the person that's mistreated that suffers in mistreatment situations. The families, the people that are working there so hard to make things better, and yet when something happens, everybody turns to the workers, like what have they done? And I think that here we have researchers, we have members of the public, we have online also people that practice. And you know, what recommendations do you give, you know, to those people? What can the individuals do in their day-to-day practice to do something about this problem, to lower the suffering for everybody actually that's involved in these situations?
Well, like I said, the first thing about mistreatment is it's about harm. So often we try to catch the bad person who did the harm, but we're not doing anything about the harm in the first place. So even if you don't report, if you can at least alleviate some of the harm that the person's feeling, distress, that's a big part of it, first of all. And also it's about trust, okay? Mistreatment in definition, it's somewhat in which you have trust, okay? So it's a big trust issue for employees and everybody also. So I think that that's important. So even if they don't trust, let's say, the management or the employees, if they can at least trust one of the employees or their family or another person there, it's actually helpful and alleviates part of the helplessness, part of being scared. So that's important also. So we're always thinking about, you know, big things we have to do to counter it, but the first part is taking care of the person that's living through this type of mistreatment first and trying to make them feel better. So I would say that's the first part. About the government and other instances, like I said, it's like a snowball, you know, when it gets going, it gets bigger and bigger. We have to stop it soon with little action so it doesn't become bigger. And that's the main issue, is little action do a lot more sometimes than big ones in this type of situation. And that's important. Like I said, just giving water alleviates part of the distress. So something we think we need big action, but not always. Small ones do a big difference in the lives of the different persons. Your turn.
You know, one of the things that I think can be done is we need to manage better. I think that there's been a growing, you know, I think the federal government has been funding healthcare properly, and that's hurt Quebec. And the federal government, you know, under, you know, the current government has been hiring a lot of bureaucrats, and I think that's hurt. So there's a lot of mismanagement that's still going on. And it's the spending priorities, you know, healthcare, health and social services right now, it's $59 billion in Quebec. That's 41% of the Quebec budget. So it's an enormous sum. But it's also the, you know, this the spending priorities that the government has in other areas. We have to, as a society, get our priorities straight. But I do find that there's a lot of a thick layer of middle management that we could streamline, and have that money going into the care, into quality care. But I don't know why that there's not, like it's actually going in the opposite direction, at least federally. So that's an unfortunate trend, but that would be another thing that we can do in addition to, I really, really agree with you in terms of these relatively simple solutions that yield great results and don't really cost that much, where we can, I'm a big believer in innovation, we can do that. But I think that the situation will likely get worse before it gets better. We should be on guard against that. But today this whole event is a good first step, right? It's a necessary step.
I think, like when I show my film around, or when Melissa goes and speaks, the lawyer that I followed, people are always saying, what can we do? And she believes that part of the fight needs to take place in the courts when there's real mistreatment and egregious things are going on. It's even though it's very hard for the families, it's worth taking your story, documenting what is going on, really not giving up, but it's a huge sacrifice for these families. These cases go on for a long time, and I would say the families don't look for money, but they're using the courts to try and get some kind of justice, moral justice. So there's that stuff that's going on in the courts, and it does really require families to step up. But it's also, I think, activities like this, it's like all the hotlines, we have to keep talking about it, knowing that most people don't want to hear about it because it's a scary topic. But I think we just have to keep talking, not giving up, and talking to our politicians, and just, it's going to be affecting all of us. We're all going to know someone, or it's going to be us. So we just have to keep going.
Thank you so much. As a matter of fact, older adult mistreatment either has affected people here in the past, in the present, or possibly even your own future. So this is about safeguarding, what's being done and the monies that are being spent, so that we ensure that we will be taken care of in the future and those we love. So I think that it's a work in progress. Before I pass it on to some of you online as well, if you want to ask some questions, I just want to tell you there is an investment that's been done by the government, which is the Elder Mistreatment Helpline. And this helpline is open 7 days a week, and it's opened 12 hours a day. So if you have concerns, and we talked about some people are afraid to report, you can call that line anonymously if it's to get information or to discuss a particular situation. So we're going to give you the number, but I think it's important to note that there is a place where professionals who know what the laws are and who know what the resources are can be supportive.
Calling the line is not to report. So calling the line, it's about talking about it, getting information, and then they're going to tell you how to report. So you're not reporting when you're calling the line. That's important to say, because some people don't want to call because they think they're reporting. You're not reporting. You're talking about it and trying to understand what's going on. So that's the first step.
And actually, it's a recognition that reporting is a process. First, people want to verify, am I seeing what I'm seeing? And then it's like, am I safe to talk about it? And then it's okay, what's my best way of going about this, and who can support me to do that? So I want to share that with you. That said, I would like to open, questions to our audience here. And please do not speak of specific situations, but please ask general questions and keep them short. Okay, so.
Also, friends joining us on Zoom, if you have any questions, please feel free to put them in the chat. Lena, I saw that you had a question there, but I think we have answered that. If not, let us know.
one of my, actually I've got two questions. One of my questions is that I think it's not only what you're doing is publicizing it, but sensitizing the importance of family. I've been a primary caregiver, I was a primary caregiver for 6 years. And, you know, it was a constant supervision at the long-term care. The second thing I want to say, and this is just a personal experience, I have reported, if there were a group of us four, reported some of the, I suppose, neglect what they had. It wasn't really mistreatment. And you know what? The CLSC, or whatever they're called now, the CLSC actually stopped admitting people to that facility. So at the end, we ended up, instead of having, let's say, 20 people on the floor, we ended up with 10. Great service. So it does work. It went into the papers, by the way. My son was interviewed on the radio, so we were all over the place. But I think that's one way of doing it. But also, we have to sensitize the public. And to me, because most people don't want to talk about it, I realize that. But you know, we may all end up at that place. Anyway, one question. I didn't ask. Yeah, one question, very fast. How will centralization of the healthcare system affect? Or is that what?
Okay. Okay, so I'm saying what in theory the idea is, okay? So the idea is that they're gonna have new instances, new part of the system that will be thinking about innovation, because right now we're so much into crisis and resolving situation that people who are upper management are just doing that, so they don't have time to innovate. So that's why they're putting something. I don't know if it's gonna work or what's gonna happen about that and which problem they're gonna look at, because like was said earlier, is that every part of the system is actually linked together. Okay, and what people don't talk about enough is that there are other services missing. The healthcare system is really for health care, mainly social services a little bit. But when you do want to stay at home, you need somebody to cut your lawn. You need somebody to change a light bulb. You need somebody, because we do projects also. We have a living lab in Côte Saint-Loup looking at everything else. So to help people's age in place, you need a lot of other services, and that's a problem also. Okay, because it's not just about care, health care, it's about other things. So we're relying a lot on the healthcare system, but they can't give us everything we need to stay at home. And also, we're talking about long-term care. Long-term care is really for people who have no other choices. And you were talking about families. The people in long-term care are really like more than 4 and 5 hours per day of care necessary, and usually people can't keep them at home because most of them will be at home. No, I know, that's a problem, is that the families then go say, okay, I can't take care of that person anymore, they're gonna go in long-term care, I'll visit them, and then you end up doing a lot of the work because the care workers are strained, but we saw it. The best proof was actually during COVID, because when families couldn't go into long-term care, everything happened, okay? So it just proved that the system is a little too reliant on caregivers. They didn't know they were reliant on caregivers until the pandemic hit. And then they saw that families are doing a lot and everything. And the other thing, as was said in my resume earlier, I work a lot with mistreatment within the caregiving relationship also. So imagine, even if you love that person a lot, at one point it's just too much, and sometimes you can neglect, sometimes you can lose your temper. So taking care of somebody who's really sick is really hard. It's not fun for them either. It's not fun necessarily for the caregiver. There are some good parts, but so what you're saying is that what surprised you and is that you actually, when they do go in long-term care, the caregiver has to be there, the families, to make sure that everything is fine. And then the problem is those who don't have anyone visiting, then there's the one that are being left behind. So this is part of the problem, is that we need surveillance in a way for things to go right. It's like if nobody's watching, then we know something's going to go wrong or somebody's going to be left out. And actually, in the literature, that's one thing that says that works to reduce mistreatment, is actually have people there, have management there, checking everything all the time, and also troubleshooting, because there's always things happening. So you do need people there to think and solve problems all the time to make sure that things are going well. And say, oh, we're missing this stuff. Okay, somebody's gonna get it. So you do need management. So in the literature, that's one thing, there has to be somebody on the floor managing things for things to go right. If nobody's there to check, things are gonna go wrong. Yeah, and it's not supposed to be families checking all the time.
Okay, do we have another question? Yes. Thank you.
Thank you.
Actually, I have two. Well, first of all, I've learned and I've read that in countries that have the same level of population and Quebec, more or less, mainly Scandinavian countries, the situation of older people who need care is much better taken care of. Now, I'm not sure if that's true or not true, but you were saying that it's bad all over the world, but I've read that it's not that bad in Scandinavian countries. And what I have read seems to relate to the fact that they have a better home care services organized. Now, I've also read that home care services cost a lot of money, and that people think that, well, if you don't want to send people in long-term care facilities, just keep them at home, which of course we want, and I do personally, but it doesn't cost less money. So, and I look at the Quebec government, and they put up their Maison des Aînés, which cost a lot of money, I mean, at least from the public point of view. So my question is, you've been close to what the Quebec government is doing. They have a Ministère des Aînés. What is that ministry doing? What are its priorities? How much money does it have? Is its budget actually sufficient to do the job that it's supposed to be doing? And I know that long-term care is dependent, is related to the Ministry of Health budget. But, I read the paper and I listen to the news and I'm very confused.
Okay, so there's a simple question for you.
Okay. No, but you're right. I actually got another degree in public administration to try and understand everything, if you want to know what the government's doing with the money, one way to do that is actually to go online and look at action plans. Because in action plans, they're telling you where the money is going. They're even now telling you which organization is getting the money to do that part of the action plan. And they have the budget for their whole action plan. The thing is, for long-term care, there's a plan for long-term care. There's a plan for caregiving. There's a plan for mistreatment. Okay? Yeah. So sometimes they have measures that kind of overlap these plans. And that's why I'm on committees for long-term care, I'm on committees for caregiving, I'm on committees for mistreatment. But the thing is, since I have a lot of expertise also in technology, I'm in all the committees, so I actually have a nice view of everything's going on. So the first thing you have to understand is when you want to solve a problem is what's the definition of the problem. Okay, which means if they think it's a problem about management, it's going to go in one action plan. If it's a problem about mistreatment, it's going to go somewhere else. So depending on how it's kind of conceptualized, it's going to be in different budgets, just say it that way. They are doing so many things about mistreatment. If you go in the action plan, there's I think in this one, 59 measures. The research chair is actually one of the measures in there. So they know about the problems, like I said, it's trying to find the solutions. You were talking about other countries. Other countries are kind of structured differently, and if you go to the States, it's actually all private mainly, okay? So we're in a public system. The problem with the public system is that when you have a public system, is everybody's getting almost the same thing, you know? So the thing is, so you're not gonna have a choice, you're gonna get something better there, and you know, a little less expensive here, everything's the same. So in other countries, and here too, we're starting to see a little bit of private, okay, services. So when you want the Cadillac, you have to go maybe pay more, but you already paid for the other services through taxes, but if you want more, you have to pay. So this is one thing. We can see it also with surgeries and other stuff like that. For once, I actually like the Maison des Aînés. I'm going to tell you why, because it's not the bare minimum. For once, they're doing something for older adults that's actually nice. And, you know, it's not cheap. That's stupid to say, but that's so they actually did put money in to have something interesting. The problem is that it's really long to implement. And the other thing is that they're having problems finding staff. So they would have been all up and implemented, but they have the same problem as everybody else, the staffing problems. So that's not necessarily a bad idea. That's actually a good one. Instead of having something cheap, we're going a little up and saying we're putting money for older adults that's going to at least look good and have something nice to offer. So in other countries, they actually have, it's not necessarily the same level of government that's using that are giving out services. For example, in France, it's more the municipal government that are putting in different initiatives. And that's what we're trying to do we're doing a living lab in Côte Saint-Luc, and we're trying to see what are the needs of the population, but also what can be put in place, because like I said earlier, the healthcare system is there for healthcare. The rest has to be provided by other companies and things like that. But the problem is right now you want to have your lawn cut, and it's hard to find somebody. So right now we're having problems, everybody's having problems, not just older adults, finding people to do chores and things like that. And that's what has to be put in place also to keep people at home and also help caregivers. I mean, if you have somebody coming around and helping you with different tasks, you can keep your spouse or your mother, father longer at home because you're not doing everything. You know, so we do have to put other things in place. And when I say put other things in place, we're talking about making profit. So there are different projects going on. So it's more co-ops. It's more non-profit organization. Even for housing, we have to go there. Because right now, a lot of people, and I did see that in, like I said, the mistreatment in seniors residence that was doing the other project. So when it's about money, I mean, the service isn't better always because it's about money. So we do have to have some pieces of the system that's public, but like I said, don't expect the Cadillac if you're in a public system, but also have offers from nonprofit organization companies. For me, the main problem is that there isn't enough funding for community organizations. And it's not just about funding community organizations, it's funding them long term. They have to fight for money about every year, sometimes 2 years, 3 years, so they cannot put project in place, keep their staff that is really devoted because they do want to help. And so that's a problem. If at least you get funding every 5 years and not everybody's at the same time or something like that, you're going to be able to build something that's going to be there for a longer time. Because the problem is when you bring a new program in, you have to publicize and say, people have to know about the program. This takes a long time. Even the line, I talked in interviews about the line. Most people don't know about the helpline still, and it's been there for more than 10 years. So even if you do have services, people have to know about it, and it takes time, and then you have to build a clientele. But we do need options that are not about the money. That's for sure, because you're not getting really that better services, and people are taking advantage of older adults and their families and things like that. And people don't have money anymore because, I mean, everything is getting so expensive. So this is what we need right now, and that's what I'm talking about with the government about funding the community organization and things like that.
Thank you. We have time for one more question. I'm going to take one from this side.
I hate being the last question, but it's about, I think what you've said is it's so systemic, and it's about ageism, and it's so hard to deal with. And I'm finding from, what we listened to last week was Rekha did a podcast with Ryan Backer about ageism, and he was talking about self-directed ageism, like where we ourselves, every one of us, looks to the long-term care facility as the end, like that's where we're all headed, instead of looking at our lives as we live them and how can they be better. And I think if we started to do that we wouldn't be all ending up so long in long-term care facilities, and it wouldn't be the last option, and we could look at other ways of, and it involves us all in changing our mindset, really. But I don't know what you think of that.
It's funny because the first podcast we actually recorded in English is about self-directed ageism. So I know, as you can see, I left my hair natural, and I'm fighting a lot of ageism just by doing that. I mean, it's kind of stupid, but a lot of people came to me after seeing you. I let mine become gray too. After hearing you talk about ageism, self-directed ageism also. So because normally half the population would have gray hair. Okay, because that's the normal aging part. I'm 40, almost 48, and you see mine is all gray. I'm gonna go really white like my father for sure. So you know what I mean? It means that, and you have to know that long-term care, it's only 6% of older adults. Most people will never go there, okay? But you're talking about, if I go really fast about self-directed ageism, if you think you're too old, you will act differently. Oh, I'm tired, that's normal, I'm old, so you won't go to the doctor. Maybe something that's gonna go really bad real fast if you don't go to the doctor, okay? And you say, oh, I'm not going out because there's too many young people out there and I don't fit in. Then you'll stay alone at home and you get depressed. Okay, so if the minute you're thinking I'm too old to do something, you're gonna change your behavior and you're ruining your aging process. That's pretty much it. So you got, and I always say aging, age is a bad variable, okay? If you say, I'm too old to do this, that's not the real reason. You're not too old to run a marathon, because I know people really old who are running marathons. You're not in shape to run a marathon. If you say too old, you can't do anything about it. If you say you're not in shape, maybe I should get in shape and I'll be able to do something about it. So you always see what's the real reason behind the age thing, okay? So that's super important. You have to change your way of thinking. But you're right. So if we change our own way of thinking, we become less ageist with other people, and it's a movement. I see it as a movement. I'm still going to be working for another 20 years probably, but what I'm seeing is that we're trying to start the way people are seeing things with mistreatment. I see a difference. I know you've been working in that for 35 years, but we seeing things go forward. It just takes a long time. But if you change your attitude, your way of seeing things, of seeing aging, and there are good things in aging too. I always say the problem changes with the age. So when you're younger, you have other problems and other perks, and then you switch when you get older. So there's not a problem. So the idea is really to get the movement going. Being old is normal, having gray hair is normal, we're still having fun, and it's not like, it's not a downward slope. Far from that, even health-wise, people can be in better shape older than them when we're younger. Like I said, when the kids get out of the house, now we have time to actually get in shape. But that's it. So it's really not that. And studies are showing that too. So I'm just saying it to make you feel better. It's actually true. You can be in way better shape, happier. People are happier in their 50s and their 60s. It's actually the young people who think that aging is crap that are actually depressed because they they say, oh my God, I'm supposed to be in my prime in my 20s and 30s, and then I'm not in my prime because everything's going to go down from there. And when I talk to younger people, they say, oh no, it does get better. Yes, stop stressing, just live your life. And then, and so much pressure on younger people, Botox, don't want to get old because getting old is bad. No, it's not bad. It's different, you know? So we have to change this point of view, and older adults don't exist, okay? Really, doesn't exist. It's just people are older, that's it. It's a process. You don't wake up at 65 and go, oh my God, I'm an older adult today. You know what I mean? It doesn't exist. You're just adults. And if we keep thinking older adults and adults, then that's how we get discrimination, stigma, and everything. It's just people, it's adults, that's it. They have gray hair, that's it. You know what I mean? So it's that barrier of saying adults and older adults, for me, it's a problem already. So people are people, that's it. We're all adults, that's it. Forget about your age and do what you want.
Thank you, Mélanie. Well, before we close, first of all, I think we've seen how there's an intersection of so many issues and problems behind this mistreatment. And I think that's been fantastically presented by our panelists, and the work you do actually is what puts it in the forefront and gives it a lot of attention. And I think that all these different mediums are what's going to continue to make a difference. And this is the message we've been given, and I'll let you give one last message is, we all have a role to play in our own aging and in how our society will address issues as we age. So, the job is cut out for all of us, and it's all our responsibility. So I take any last comments from yourself, go ahead. Do you have any last comments to make?
Oh, I don't really have comments.
Okay. Well, I want to say thank you very much. Thank you very much for your questions and for joining us today, and even people online. And remember that we do have a helpline, and we'll give information about that if, in fact, you have situations that you need to discuss. Thank you very much. Constance?
Thank you so much, everyone, and thank you to our moderator, Sarita Israel. I also want to let you all know that we have an afternoon event as well at 2 p.m. We have a panel called Who Am I with the author, the sci-fi author, Shawn Michaels. And anybody who wants to join us for lunch will have lunch served here around 1 o'clock. So thank you.
Thank you, everyone, joining us on Zoom. Just to let you know, we'll leave the Zoom open, but we're going to close up the live stream. And just a reminder that this conversation remains available on our YouTube channel. Have a good afternoon.